Welcome everyone to our monthly Meet the Team workshop. These used to be done in person at the naturopathic office of Higher Health, which was right at Yonge and Yonge Boulevard, a beautiful space. And then when COVID hit, we decided to start doing them again, but virtually. So how this works is that we have a main topic, and tonight's main topic is planning for birth and baby, which we thought would be quite helpful for all of you. And you're going to hear from a couple of our team members who are going to present on a more specific part of that topic. At the end, we've teamed you up with one of our team members to just answer any questions and get to know you a little bit more. So we can kind of go from there. So this is our October Meet the Team. And you know, we know that having a baby can feel overwhelming, and this can happen, you know, even in normal times. And we also know that planning can help. So whenever we have something big going on, when we look to plan and we learn some different things, put some things down, have some conversations, then a lot of times the anxiety goes down and we're also able to go through the process a little bit easier. So we'd like to help with that today. There are different ways to plan. We want to plan for the birth, for bringing home baby, also understanding newborn behaviors. They seem like these little alien creatures and do all sorts of weird, strange things. So understanding some of those common things can be helpful. Planning for infant feeding. So infant feeding is one of the biggest things that we need to do when baby comes home. So making sure that we have some information and we plan for that. Relationship changes. So there are relationships within couples, but there are also relationships in our life that also change. And so we're going to have a little chat on that. And then the financial changes. And this is also something that we want to plan for. So those are going to be our topics tonight. Our first presenter today is Ali Mercedes. She is a birth and postpartum doula on our team, and she actually fell into doula work while working as an au pair in Italy. Her favorite food is a New York style bagel from, how do you pronounce that, Ali?
It's Gripes.
Gripes, from Gripes. And where is that? Is that in Toronto?
Yep, it's on Bathurst.
Oh, okay. Well, one of these days you will have to treat me to a bagel from.
Oh, you bet I will.
So, so we would love to hear from you on planning for your birth. Take it away.
Awesome. Thank you, Christy. Yeah, just like she mentioned before, before I was a doula, I was working in childcare, but I was also an educator and project manager. So it feels kind of fitting for me to cover this portion of planning for your birth. So let's just unpack this a little bit more. I always say that you can't plan every single event in your birth. It's truly a test of how adaptable you can be, but then also how accepting you need to be when things do decide to take a detour, which they almost always do. So I personally don't like leaving my clients feeling too surprised. So we always make sure to cover every single possible option. So when and if it does happen, then there is some familiarity there, and no one's feeling left in the dark. So one of the things that I, excuse me, have found comes up a lot more now because of the pandemic is location. So this is basically just where you want to give birth. And much like any other big life event, like think weddings and maybe a baby shower, your venue can really be important for some folks when deciding where they want to give birth. I always say, when you visualize your birth, where are you and who's in the room and what is the light like? These are all questions that I like to bring up early when I'm meeting a new client for the first time. And we quickly learn that depending on your preferences, you can have quite a few options on where you want to give birth. So we'll start with the first, and this is the hospital, most popular default choice for the majority of people. There are a few questions that you should ask yourself when you're deciding on where you want to give birth, especially if it's the hospital. And with keeping a hospital in mind, I like to say, does your idea of delivery comfort have less to do with, let's say, the bed that you're delivering in, and more so about the medical backup that you'll have on hand when you're in a hospital? Other things to think about are you okay with a lot of different people coming in around the clock, doing sort of frequent checks, and potentially having not your primary caregiver as the person who delivers your baby? A couple of other things to consider when you are looking into giving birth at a hospital would definitely be if you fall into the high risk pregnancy category. So if just by default, if you are a high risk pregnancy in Canada, at least, you do have to have your baby in a hospital. A couple of other things to consider: if you are more leaning towards having an epidural or other form of medical pain relief, if that is something that you're looking for, then that's where you're going to get it, at the hospital, as opposed to somewhere else like at home or at a birth center. I always say, like, especially now, it's really important to note that things are going to be a little bit different during the pandemic. As we've all seen, it's been kind of difficult to plan around these things. Most of the time, we're just waiting to get updates from hospitals to see what's actually going on. And as we all know, things are changing weekly. So a couple of things to really keep in mind, especially with hospitals, is at the moment, it's still just one person per birthing individual, which just means it's usually not going to be us, it's usually your partner. And there are a couple of other things that have typically come about with COVID, is you'll have to wear a mask and there will be screenings. We always like to keep on top of what like the current protocols are in hospitals, and we always relay that back to you guys. As well as obviously encouraging you to keep in touch with your healthcare provider and reaching out to the hospital themselves to see if anything changes. There's a lot of anxieties that seem to come up with this, and we just try to keep this always front of mind, especially if it's something that people are really concerned about. Yep, so like I mentioned before, as of current, doulas are not able to attend births in person, but that's okay, because we've had several months now to really get super comfortable with doing virtual support. And that's another thing that we always like to say, is that something that you want? Is virtual support something that you are okay with? And you know, in the beginning, everyone was trying to find their footing, but I think now I can speak for the majority of the team that virtual support has been really, really beneficial and really valued by some of the clients that we've had. Okay, so I'll move on to the birthing center. So birthing center is what I would say, like, middle of the road. It's not, if you're definitely not interested in a clinical atmosphere of the hospital, but you're not quite comfortable birthing at home yet, birthing center is probably perfect for you. We don't have too many birthing centers in the city, but the ones that we do have are amazing. They're quite homey, and they're more of like a low-tech option for folks who are a little bit more interested in having a natural, non-medicated childbirth experience. With that, I would also add that if you do fall into the category of having a high-risk pregnancy, you are not able to be at a birthing center. So just like I mentioned with the hospital, always keep in mind, like, when you're visualizing your birth, is that a place that you can see yourself birthing in? So asking yourself, well, do I want an epidural? If so, then you probably aren't a perfect fit for a birthing center. But if you're somewhere along the lines of somebody who wants to try to do it a little bit more naturally, then I would definitely keep that in mind. And that could be a pretty viable option for you. And then we go on to home births. So if you really want to have a private birth experience, you do have the option of giving birth at home, which is great. This has definitely been more popular amidst the pandemic, and it's hard to not see why that's the case. More people are feeling a lot more comfortable being in a place that's familiar to them, birthing in a comfortable surrounding where you have, in a way, a little bit more control, as well as no routine medical interventions and checkups. I would definitely say it's not for everyone, of course. It's the same as a birth center. You can't birth at home if you're a high-risk pregnancy, but it's definitely for you if you feel that you are interested in birthing in a more comfortable, familiar environment, and especially if you want to go towards a more natural route with no medical interventions. Definitely I would keep that in mind as well. And then I always say, no matter where you decide you want to birth, super important to always have a backup plan in case things go from smooth to a need for medical intervention. Even if you are like super set on doing something, we always know that birth has its own agenda. So I'll quickly go over birth preferences versus birth plan. So you probably have already heard the term birth plan floating around in the birth world. I personally don't like to call it that. I prefer to call it either birth preferences or a birth map, because no matter how hard you try, you cannot plan your birth. There's absolutely no way that we have control over our bodies. Normally with, actually, I'm going to give a little background to that, why I like to call it a map. As someone who does a lot of hiking trips, I know that you can have, like, you can be set on an ideal path, but it will always have detours and it will always have roadblocks. Being prepared can seriously lessen those anxieties that come with sudden changes, and that can really mean the difference between like a nice, smooth and comfortable birth and something a little bit more chaotic. So when considering your birth plan, just like deciding where you want to give birth, go over your priorities. So what are some things that you absolutely would love to have in your birth? Would you like it to be medicated or not? Do you prefer a water birth or birthing in a hospital bed? Are you planning to have or a planned cesarean or minimal intervention? So there's so many things that you could consider, and this is also why we are here to let you know what those options are. With creating your birth preferences, I always say take a little bit of time every day to visualize your ideal birth. Think about what the room looks like, who's there, what sounds and smells and lights, and do you have a doctor or a midwife? Is it quiet or bustling with a lot of energy? And then visualize the complete opposite of what you consider your ideal birth. Typically, it always results in a healthy baby. So once you have all of those things in mind, remember that the things that you have are I guess preferences are just what you prefer. Birth always has a mind of its own, and it has a clock of its own, and it's going to do what it wants to do. It's so important to be open to alternatives should things not go to plan, which they almost always don't go to plan. How we would support you, honestly, a huge part of our work together is discussing your ideal birth, weighing some of those potential options that may arise, as well as getting comfortable with that and learning how to cope should things change when they do. I spend so much time with my clients going over their concerns, exposing them to what sort of sensations might arise in that situation, and then really unpacking it. So I always know how they would need my support, and then what we can expect of each other. So in a way, we help you discover your birth preferences and show you what your options are, but we also provide you with the tools necessary to cope through change, and also make informed decisions for your own birth. my goal is honestly just to hopefully make sure everyone feels comfortable and confident no matter what path they have to take, even if it's not the one that they intended. So I'll just leave it at that. And I'll pass the mic over to Sharon.
Well, Ali, that was wonderful. Thank you so much. So much information, and you're right. There's lots to consider, and sometimes we need to have someone walk us through all of these options. So thank you for that.
Yeah, thank you.
So next, we are going to introduce Sharon. Sharon's support comes from the heart, and babies and parents can feel that. She's a postpartum doula. Her favorite food is cookies, and she would eat them all the time if she could. And I know this for sure. She definitely could. So that's a little bit about Sharon, and she's going to talk about preparing for baby.
Yes. Can you hear
me? Oopsies, I muted her. You're muted for a moment. Let me see if I have to ask you to unmute.
challenge? Sorry, guys.
There we go.
Okay, there we are. Thank you. Well, I just think that it's a lot smoother for everyone who is planning a baby if you have some things set up, ready to go. So these are things you don't even have to think about when the baby gets here. And just by doing a little bit of early preparation can really make coming home with your baby so much smoother. So before the baby comes, to get your house set up, one of the things that I suggest is put a quick reference phone list on your fridge of, you know, the poison control, your mom, your husband's work number, your doctor, just in case somebody else comes. It's just so much easier to just be able to just go there and you've got your quick list there. Another thing that I suggest is that you start a folder, and that is for all of your new items that you get. Put the warranty paper in there, put the how to use things in there, because you will be getting a lot of new gadgets, and it's good to keep them all together. Making a list of all your gifts. Like, you always think, oh, I'll remember who gave me what, and guess what? There is really baby brain, and you will forget. So try as much as possible, either on your phone or hard copy, to make a list of the gifts you've received and who gave them to you, because I know for sure all you would like to send off a little thank you to those people. If your home is on 2 floors, which a lot of people have, it's a good idea to make 2 changing areas. So you've got your upstairs with your change table and, you know, the baby's room, but you'd like to probably have one on the main floor as well. And that doesn't have to be another change table. It can be something as easy as having your diaper bag packed with your diapers and your wipes and your creams, and a little pad that you can change baby when they're small on the couch. But you don't want to have to keep going up and down the stairs, especially after you've had a baby. You're really going to want to try and stay put. So that's another one. Another thing is to have a baby nest. You can get one of those little baby nests or loungers. They're very safe for the baby to sleep in, and that way you really don't need 2 cribs. It's not necessary. The next thing I want to talk to you about is what to expect, like how to plan on what to expect. So one of the big things that a lot of the moms do not expect and are very surprised by is the exhaustion. And you are going to be so tired after this. So usually you've had less sleep before the baby was born. You're uncomfortable, so the last couple of weeks you haven't been getting really good sleep. Labor takes so much energy out of you. At first you're going to be all high on all your hormones and adrenaline and everything, but it is exhausting. You actually exert the same amount of calories giving birth as you do running a marathon, so just remember that. Adrenaline, hormone changes can really cause you to crash. Newborns, they like to eat usually every 2 to 2.5 hours. So you have to plan on that you know, you're not going to be getting full night's sleep when you get home to recover. You're going to be up with your new little person. And usually feeding is at least 30 minutes. So you really have to try and plan on getting as much rest as you can whenever you can. So when don't have anxiety when you come home, because that also affects your sleep. Just try and enjoy this time because they only stay little for such a short time. So if you're planned ahead and you know you're going to have these issues come up, it usually makes things a whole lot easier. So those are things. Another thing that parents don't always, moms don't plan on, is that you really don't have any time to eat, and that's really important. So trying to prepare ahead of time to have homemade meals. If you're going to have a shower, it's nice to ask people to do a food shower and ask your friends and family if they could make an extra meal somewhere a couple of weeks before and freeze it for you, because it is so great to be able to just know you can pop something in the oven or the microwave and you've got a meal ready for you. And you can also do this yourself, preparing ahead, doubling up on menus so that you've got your food put in the freezer. Have lots of healthy snacks. That's so important because you're going to be kind of on the fly and you do sometimes forget to eat. So if you like, you know, fruits, nuts, veggies, cheese, all these yogurts, have all that together and ready so you can just snack, be a little snacker. That really will help. And also, you have to remind yourself to eat because you're going to be so busy with all the other things. The last thing you're going to think about is yourself. And if you're not well, then the whole family is not well. So as a doula, that's usually our biggest challenge, is not taking care of baby, it's taking care of mom. So those are some of the things. Things you can plan for with the healing process. So before you have the baby, if you can get ready and you could have some padsicles. So what is that? That is sanitary pads that we sprinkle a little bit of witch hazel on, or if you don't have witch hazel, a little bit of water, put them in the fridge and it stays cool. After you have your baby, especially if you have a vaginal birth, you will have some swelling, and it's really nice when you change your pad to have that cool feeling down there. It really does help with the swelling and it really feels good. Another thing is sitz baths. They're really good, nice cool sitz bath. That will help with some of the discomfort. And always use a squirt bottle or a spray bottle. Don't wipe with the tissue after urinating. It's better to just spray and get that urine off. And sitting backwards on the toilet. That sounds weird, but honestly, when you come home and you have to go to the washroom, if you can straddle the toilet the opposite way, it's so much more comfortable. Plus, you have the back of the toilet to push yourself up if you're feeling a little bit weak. So those are some things with that. A lot of moms have problems with their first bowel movement. So what we suggest is that you wrap some toilet tissue around a couple of fingers. And when you're doing your first bowel movement, it sometimes feels like pushing for the bowel movement is going to cause a tear or a problem, which it doesn't, but you have that sensation. So by pressing up on it with your fingers, pushing up in your perineum area, it allows you to do what you need to do, because we need you to do that. And it's just more comfortable. And always take stool softeners. We really, really recommend that you take stool softeners for at least the first week or so until you get yourself back into a rhythm. Pain meds. This is a big thing. A lot of times the moms forget about their pain meds. It's really super important that you keep on top of that. If you're allowed to take it every 4 hours, set a timer. You really need to keep on time, because if you forget and the pain gets out of control, it's very, very hard to get back to a comfort level. If you just take your medication on time, you won't get to that really hitting the bottom. So try and remember to always set a timer. You are important and you need to take your pain meds. The other thing too is a lot of times I'll go see the moms in the first couple of days and they forget about their own personal care. And I'll walk in and I'll see this poor mom who looks like she's just been dragged through a mudslide, and I'll say to her, you know, have you had a shower lately? And I don't mean it in a bad way, but you really need to think of yourself. And having a shower is usually one of the most soothing things for yourself. Have a nice shower, even if you've already had one in the morning, just for relaxation. the shower is awesome. So always try and give yourself time for a nice shower. So the next thing I want to talk to you about is planning help. Most people are lucky, even with this COVID, to have some help. And so one of the helpful things that a lot of people are finding right now is joining a mom's group. So there's usually mommies groups in almost all of the areas. And it's really nice to be able to reach out to someone who is going through what you're going through, or can give you some tips on different things. And it's also nice because a lot of these moms groups are willing to share the baby items. So many things you get and you're never going to use them, or you've got so many sleepers in one size, or you get too many diapers. So a lot of times these moms groups are really good about, at a very low cost, or even just giving them to you free. They just want to see the things be used. So if you can join a moms group in your area, I think it's very helpful. Like I mentioned before about the food. So one of the things that I always suggest when I see a new mom is try and have a food shower, because I'm telling you, having the food ready ahead of time is just so great. So especially if people want to stop by and see the baby, a lot of your friends and family are going to say, so how you doing? What can I bring for you? They're saying that seriously. They really want to help you. So I always say, never say nothing. Okay, people want to bring you something. So one of the best things you can do is ask them to bring you a frozen meal. So if they're going to come tomorrow or the next day, just ask them, do you mind, like, if you're making something, I know you're really great at making that lasagna. When you make it, could you put a little aside and freeze it for me? So people love to feel like they're helping you. And one of the biggest things they can do is the pre-ready food. Ladies, don't be super mom. Okay, super mom loses her cape usually about 6 weeks. So in a lot of cultures, the women are to stay in bed for a month to 6 weeks. And over here in North America, you know, we see these moms who are doing sit-ups in the hospital, and they come out and they're like wanting to go to the gym, and they've got their coffee dates with the girls and everything. And then we get a call about 2 weeks later because this lady is like just wiped right out. So don't try and be super mom. It's really not necessary. You'll have lots of time to show off your new little person to all your friends and family. So, you know, don't try and do everything in the first day or two. Just be like some of the cultures from, you know, Asia and Europe, who really do give the mom and baby time to bond. Restricting visitors. Now this might sound kind of mean, but honestly, it's one of the best things you can do. So when, hopefully it's not COVID, but hopefully when you have your baby, don't space everybody out in the course of the day. So you've got your friend coming in the morning, you've got someone else coming at lunch, you'll have, you know, your neighbor come over at noon. Like, you really need to limit it, because you need that time for yourself, for napping when baby naps, and also just to get yourself together. So plan 1 hour a day. Figure out early what's the best time for you and the baby. And if people want to come, you say, oh, that'd be great. Can you come by it too? People are going to accommodate you because they love you, they care about you, they love this baby. So they're more than happy to come at the time that you suggest. And then also say to them, you know, like, I really am only good for about an hour. So tell people ahead of time that you're, you know, I'm not, you know, we're not going to have a 2.5 hour coffee time here. We're just going to see the baby, have a little chat, and then I really need my rest. And feel free to say that, or have a doula or someone tell people it's time to go. One of the biggest problems I'm finding with moms is their cell phones and their emails. You really, really have to leave your phone off, totally off. Turn it off. It is such a time waster, and it's such a distraction. You really don't need to have that phone beside you all the time, buzzing and ringing. It just is a distraction. You need to just stay calm, give yourself some time, and then once or twice a day, grab your phone, check for messages, do calls, and what I do suggest is making one message for everybody and say, I'm going to give you a little update every day and just have your list of people that you're going to send off a quick text or email. Bring them up to date. This is what I did today. This is how the baby is. Miss you guys. Talk to you tomorrow. So you're not having to call individual girlfriends or your aunt or your cousin or your mom. It really does take so much pressure off you if you don't have that phone ringing all the time. Every opportunity you get, try and nap with the baby and delegate. Delegate things. So delegate meals, housework, shopping to friends and family. Like I say, most people really do care about you and they really want to help as much as possible. So the more you delegate, the more you're empowering that person to feel good about what they're doing for you, but you're really also giving yourself that time that you really need. So try and sleep, girls, as much as you can. The last thing I wanted to talk about is partners. So partners, they can do a lot and they can really feel great about the birth, or sometimes partners really feel left out. So before the baby comes, I always suggest walking through things with your partner, because most men are pleasers. They'll do anything to make you happy, but they don't know what to do. They're just useless that way. So if in the kitchen you can show them, okay, honey, this is how I make my egg. So it's not like rock hard or raw. Show them how you like it. Give them a break. Show them how to do it. Show them how you like your snacks, okay? You know, you might like carrots and he gives you a carrot, like a full-size carrot. No, I like them cut a little bit. If they know what they're expected, they're really happy to do it for you. So spend some time with hubby and show him how to do it. The other thing too is show him how to use the appliances you have at home. Maybe dad is not a regular with the dishwasher and he doesn't know where the soap goes or something similar like that. So laundry is the same thing. Show him how to turn on the washer, how to do the dryer. Like I say, dads are usually super happy to be involved. They want to do whatever they can for their wife and their baby. So those are great things. One of the things I always encourage is skin to skin. Get dad with his shirt off. He should be hugging that baby all the time, just skin to skin. With the baby in a diaper and him with his shirt, he can watch TV, he can do whatever. It's so important because that is the time the baby gets to get used to his smell, his heartbeat, and it gives dad that confidence. If he can sit on the couch and hold the baby, guess what? He can walk around with the baby next couple of days. He's feeling more and more confident and more part of this whole thing that's going on. So that's another one. Last but not least is take turns with your partner for sleeping. So don't both of you be up at the same time. Try, if you can, when dad's home, go have your little nap in between feedings. Then when you're feeding, you take that shift, spend that couple of hours and encourage dad to go and get some rest. Because the worst thing is when you have a family where everybody's exhausted. So by, changing off, it really gives everybody that chance to have some quality time, have some personal time, catch up on emails, and everybody feels really good. I always say too that usually the 4 a.m. feeding is really lonely for a lot of the moms, whether you're breastfeeding or you're bottle feeding. By that time, you're so tired, it's dark outside, and you could feel like you're the only person on this earth. So I always suggest that would be a really good time to ask dad to come and spend time with you in the night. So if dad is there, he can offer to make you a tea, bring you a juice, some snacks. You're just going to feel so much better and so much more connected with dad if you're having that quality time together. You can chat, you can snuggle, he can be with baby, and you won't feel so alone and so isolated. And it's one of the things that's going to help you guys in the future to get your relationship back on track. You need to have that cuddle time, that loving together still. So these are great little things that you can get dad to do and really get him involved. So guys, that's just a quick note. I had 3 pages. Christy turned it down to 1.5 because I do like to talk too much. So anyways, it was nice meeting everybody. Good luck with your babies, and call us if you need us. I do postpartum at night, and I love my job. There's no better job on earth than what I have. I'm a lucky person. Thanks, everybody.
Those were fantastic tips. And honestly, I've never even thought about doing the reverse toilet. That makes so much sense. from each other too. And
Just
next,
if you have a baby, I'll come and help you.
okay, done. So next up we have Sarah. And Sarah believes every woman deserves to be supported and cared for after birth. And she was professionally trained as a chef. However, we have not gotten to taste her delicacies yet, Miss Sarah. So I would like some of your delicious treats. So Sarah's talking. Oh, Sarah might be muted.
Okay.
Nope, we're unmuted.
Okay,
I'm going to pass the mic to you.
great. Okay, welcome everybody. We're really glad that you're here. And I'm going to be talking about some newborn behaviors and what's normal. Well, as we all know, all babies are different. So what I'm going to say is all guidelines. Just take that into consideration. When we're talking about newborn behavior, it's really hard to put it into a box. So what I like to recommend to new parents is to try not to stress, because there's sometimes things that happen once and then it doesn't happen again. So I'm going to kind of go over a rundown of a couple of things that are within the range of normal. So when it comes to diapers, what you're looking for in the very, very early days are 1 wet diaper per day that your baby has been alive. So for example, if your baby is on day 2 of life, you're going to expect 2 wet diapers in a 24-hour period. Days 3 and 4 is typically when the milk comes in. So the diaper output will go up a bit. On day 3, 3 wet diapers. Day 4, 4 wet diapers. And then typically by day 6, the milk is fully in, and you're going to want to expect 6 to 8 diapers in a 24-hour period. Now, newborn crying. This is one that definitely stresses new parents out a lot. And this is typically a sign of hunger. So when baby is crying, I would suggest that you normally try to put them to breast or bottle. And although it's not always that, this is typically the first reason that baby is crying and you don't know what to do, just try that first. There's many other reasons though. Like I said, there's gas, baby could be tired, could be a wet diaper, baby could be unsettled, they just want to be close. And then there are also just times that it's totally normal to have unexplained crying for newborns. And this can range between 1 hour a day, 3 hours a day for some babies. And this is typically normally, it happens within the evening hours, otherwise known as the witching hours. Sometimes the baby is just not settling, and that can also be really normal as well. So breathing. For newborn breathing, it can be a little irregular, and there can be pauses in the breathing for 5 to 10 seconds. So if you see your baby all of a sudden stop breathing, it's not a sign to panic just yet. Kind of time them for 1 minute, and normally it's going to be 30 to 60 breaths per minute. And while they're sleeping, it can actually drop down to 20 breaths per minute. So these are all within the range of normal. And they do have little times where they'll rapidly breathe, and then it will kind of slow down. So just take note of that.
That's happening in the hospital.
Okay, yes. And then one more, pardon? Okay, I'm not sure if there was a question. Maybe we'll get to it at the end. So one thing we like to say with newborn behavior is, let's take a wait and see approach. So if something happens that concerns you, take note of that. If it happens one time, for example, if your baby projectile vomits, take note. And then wait and see if it happens, maybe 2, 3, or 4 more times in the next couple of days. And at that point, you're probably going to want to reach out for help. So make sure when you're having a concerning newborn behavior, kind of wait and see, and don't try to panic, which is, I know, hard in the moment. But I also want to go on to signs of actual concern and when to actually get help. So these are actual signs that you should be worried and you should contact your personal healthcare provider immediately. So if baby has a fever of 104 or higher, that is definitely a sign of concern. If baby is overly sleepy, so this means they're not waking at the 3-hour mark, you are stripping them down naked, you're washing them with a wet cloth to feed, and they're missing several feedings in a row and just totally lethargic, that's also a sign of concern. If their breathing is fast, over 60 breaths per minute, and they have bluish skin around the lips, if they're making a wheezing or whistling sound, this is also a sign of concern. So at this point, you would want to contact your personal healthcare provider, and it's really good, like we're saying, to plan ahead of time to know where all the local pediatric hospitals are around your area, pediatric walk-ins, even local breastfeeding clinics, and there's even pediatric telemedicine lines that you can have the numbers to ahead of time. And you can be in contact with virtual doctors and have a pediatric visit and get, if you need medicine for your baby when they're a little older. So next I'm going to talk about the classes that we at Helping Hands can provide. So we provide an infant care class that you can take before baby. We provide an infant feeding class, which is good before baby, or even in those first couple days after baby comes home and you just need a little extra support. The infant feeding class would be really helpful. We also offer to be part of a postpartum group chat, which would last for 1 month. For all the questions that you have, just shoot it onto the chat and we'll get back to you right away. Or even if you weren't planning to hire us for postpartum doula support, you can also just book 1 4-hour, like a little check-in shift, which is what we like to call like an on-the-job training type of a shift. So you just have one of us postpartum doulas come in. Maybe we can show you, it's baby's first bath. We can show you the guidelines for bathing baby for the first time. We can kind of show you some tips on diapering, for swaddling and soothing baby. Anything you have questions about, we can cover a lot in that 4-hour period. And finally, I'm going to talk about resources. So as we've touched on, it's really great to have a lot of resources to look to as before baby comes, as you're planning. And I would say baby tracking apps are becoming really popular now with a lot of the clients that we serve. You can track their feeds, diaper output. You can get all different charts of which breast has had the higher percentage of feedings, whatever makes you more comfortable. Some parents don't like to use them at all and they just totally go with the flow, but I am finding that a lot of parents now are loving these baby tracking apps. Like Sharon said, the baby brain can be real and you don't even know, when did baby last pee or poo? I'm confused. So it would be good to look up ahead of time and just search up which ones you want that you would feel interested in. And then for resources, I personally love Instagram for a lot of tips and tricks. You can even search up hashtags. Like let's say you're having a clogged duct. You can search in the Instagram bar, like hashtag clogged duct, and you'll get a whole bunch of resources there. So look up before baby arrives. Again, you know, different topics that you would be interested in to have resources on. So you might want to look up websites for sleep or feeding, bathing, baby care. And if you want to, you can always reach out to us and we can let you know some of our favorites as well. So that's it from me. Thank you.
Thank you, Sarah. You're so full of information. That was fantastic. So next on our list is Christiane. And Christiane, her friends like to affectionately call her the baby whisperer. And I know that she's told me that she was definitely a doula before she even knew what a doula was. And a fun fact about her is her favorite joke is, what do you call cheese that's not yours? Nacho cheese. So Christiane, I'm going to have you unmute yourself and take over your segment.
Hey everyone, Christiane here. I love that joke, and you know what? From the ages of 5 to 11 or 12 for kids, they love that joke. So feel free to totally use it. So just a little bit about myself. So I'm Christiane, like I said, and I'm a birth and postpartum doula here at Helping Hands. So today I'm going to touch on a little bit of preparing to feed your baby. So I love this topic. There's all different tips out there that you can do, but there's a couple of things that I definitely would say to obtain before your baby actually comes, because there's going to be times in the middle of the night that you wish that you had something, and you'll be happy when you have it. So the first thing that I definitely want to tell you guys about is pre-made formula. It is already ready in the carton. You just take it out and pour it right in the bottle at 4 o'clock in the morning when you, or if you have a partner or a loved one that's staying with you, and the baby just will not settle, or there's some challenges with breastfeeding, or whatever the circumstances may be. When you buy the pre-made, you can buy them in packs of 4. So at least if you're ever stuck in a jam, or like I said, some challenges might arise, then you can definitely, go to that. So the other things I definitely, for supplies, there's a whole bunch of different things that you can buy or prep for, like a nursing pillow, breast pads, because when your milk comes in, a lot of times you'll leak. And diapers, wipes, swaddles. I'm a big proactive person when it comes to swaddling your baby. Having those perfect sized blankets that we have, and you can always Google them and look on different apps to show you exactly what they are, but swaddling is a big part. A breast pump. I definitely am for a breast pump. I personally recommend the automatic ones. There's 1 or 2 pumps you can use. There's all different types. There's the Haka, which here actually just is a really good source for breastfeeding, or breast milk, I should say. So we also have different types of feeding. So here we offer infant feeding classes at Helping Hands, which I'm super excited about. And, because there's all different types of different feeding that you can take with the feeding challenges, or just the way that you actually want to feed your baby. So there's breast milk from breast, there's a nipple shield, there's a breast pump, there's expressed milk from a cup, spoon, or bottle. There's the Haka. I'm just throwing a bunch of information at you. I don't expect anyone to wrap their head around all these things, but it's just, I'm giving examples so that I can show you that there's different ways to go about feeding your baby and, providing nutrients. The classes that you can take are so important, in my opinion, prior to you giving birth, because it prepares you and lets you know that sometimes things aren't easy. Like, that's one thing I love to say to my clients, is that breastfeeding can be challenging. And I don't think that birthing person is made aware enough that it can be challenges. It's beautiful and wonderful and amazing what the body can do, but it can be challenging. So these classes that we offer here, or at, you can get help with feeding at all different hospitals. The classes can be from hospitals, from us, the different places that you can go to get help, because a lot of times people don't know where to go for feeding challenges and who to turn to, and there's so many options, and I don't know what to do, and the internet says this, and my friend says this, and so on and so forth. So there's at some hospitals, they have breastfeeding clinics as well. Here at Helping Hands, we definitely recommend a lactation consultant. We have a wonderful lactation consultant that we refer to here, Shelly. She's fabulous. So that's another route that you can take. And there's other lactation consultants too that come to your home. So that's also an option out there, depending on if there is a challenge, or I personally recommend everyone to see a lactation consultant off the bat, because it just helps you feel more safe and less pressure, less anxiety, less stress. and it just gives you a more comfortable flow between you and your baby. And if there is any challenges, which there might not be, but definitely recommend a lactation consultant. So the infant feeding courses, like I said, we do it here. There's different ones out there. There are apps that you can go on to, like if you're registering and you don't know what to register for, there's all different apps that can help you out that way. Ask your friends and family which really worked for them. I find that the products that are recommended are ones that work best for people. And if you want to save your money, borrow, pass along, spread the love around with all the different stuff that you have out there. And if you're looking for some help or maybe some, tips on infant feeding or like literally anything, YouTube is your friend. You can find lots of different courses on there that'll give you some tidbits and let you help out. But I definitely recommend the infant prenatal feeding class. So I think that's all I have for tonight. So I just want to say thank you to everyone that's coming out, that's already here, and to my fellow Helping Hands coworkers. So thank you.
Thank you, Christiane. You gave a really good reality of what infant feeding is like. And I wanted to add, check out our YouTube channel. So it's Helping Hands Doula. We've got lots of really great learning how-to videos on there too. And not just feeding, but things like bathing and things like that. So next up, we have the lovely Fiona. And Fiona, she loves to educate and support new families. And I love her superpower. Well, if she had one, or maybe she does have this. She would teleport, so every week she could go on a vacation and come back when a client needs her. That sounds like a pretty good superpower to me. And Fiona is chatting today about relationship changes. So Fiona, I'm going to pass the mic to you.
Awesome. Thank you, Jess. All right, so relationships, they can be so delicate, especially during this emotional transitional time in our lives. So we just wanted to give you a few kind of key things and to keep in mind for certain relationships that are important in your life. And the common theme that you're going to hear, which you potentially heard from the other doulas as well, is communication. So it's not enough just to think about it. It's great if you're thinking about things, but you also need to communicate them. You need to express it so the people around you can with or what areas or what your boundaries are. Your boundaries are also very important. So also when it comes to relationships, it's important that you realize intention is necessary behind it. So what I mean by that is there's all these different things that are going to be happening around you, and letting people know, here's a way that you can help me and here's how I can help you. It builds and it helps your relationship evolve with a stronger bond. Okay. So first things first, of course, the relationship with yourself. Okay. It is actually very necessary to acknowledge that your life is going to be different. There's no way around it. We don't want to sugarcoat it. We want to be prepared for it. So sorry, one second. Sorry about that, guys. I have a little guy around me and he was just clanging and clanging. Sorry about that. So yes, being honest and open with yourself about the changes that you are going to be going through. And right now you might not know what that looks like, and that's okay. That's why we're here to help you. If you start to think about what you prioritize in your life right now, things that you need that you can't see your life without, those are the things that are really important to you. And you may just want to start to think about how that may look different for you once baby's here. The earlier you can start thinking about this, the more time you have to process how it will be different. You might even be able to have an opportunity to do more of it before baby comes. but at least you have the chance to make the slight changes that you need so that once baby's here, you can still enjoy that thing that was very important to you and also enjoy the time with babe without feeling like you're missing out on your time with babe or the thing that's really important to you. Next, we have your family and friends. So everybody has some family that, or even friends that they really, really, really want to be involved a little too much. And then we also have the friends and family that actually want to be a little more hands off and just say, you know what, I'm okay. I'm not the baby person. I'm glad you're okay. They both are great to have. So first you need to ask yourself, what do you want from them? Like, how involved would you like them to be? Because it's your baby, it's your family unit that you are creating, and it's okay to want things to be a particular way. So start thinking about what family members or friends are kind of have the same similar parental style as you, or like a parenting philosophy. So just the way that they approach their kids, or the way that you guys have started to have conversations about family and what you guys would like to do. Maybe those are the ones that you would want to connect with for advice and companionship and more hands-on baby support, because you guys already have a similar way of seeing things. And then the people that you don't really want to be too involved, they can help in another area. They can be the people that are helping run errands for you. They're doing the cooking for you. They're cleaning for you. Maybe even helping to set up events, because between baby showers, between sip and sees, between religious ceremonies that you might have, there's a lot of different things going on. So if you can delegate, like Sharon was talking about, it really lets them be involved, but in a way that you are comfortable with, without feeling too much pressure to have them come over and be the person that helps you with baby. Also, they can help with your furry babies. Pets need love and attention too, and thinking about that before baby comes gives you a chance to maybe do sleepover dates, so that your pet and that person can get along with each other and kind of get to know each other in the process. So figuring out who these people are and what categories they fit into is wonderful, because you can start the conversation while you're still pregnant. It gives them time to process what different ways that they can help you come up with different ideas, but it also lets them mourn the fact that they may be helping you in a different way than they had initially anticipated. Okay. All right, your partner. So you know your partner best. You guys both know each other's triggers, you know your general concerns, you also know what brings each other joy, but neither of you are mind readers. I wish it were so, but you guys are not mind readers, okay? So it's really easy for our partner relationship to get hidden behind the everyday flow of things. So intentionally spending 5 to 10 minutes with each other, twice a day minimum, morning, evening, just checking in with each other, okay? Checking in for every partner or every couple looks different. For some people, it's talking. For some people, it's hugging. For some people, it's just sending praises and love to each other's way. But it's just spending intentional time with each other to say, I see you. I remember you. You are still very important to me. I'm just sleep tired the rest of the day. But you got 5 to 10 minutes with each other, a very intentional quality time. And last but not least, your baby. So your baby relationship is kind of looking up inside your stomach anymore. Now you get to share baby with your partner and your friends and family that are around. So there's 2 things specifically that I want to touch on in terms of your relationship with baby. One being, baby needs to know that they can receive love in different ways. So babies are very familiar with the heartbeat and smell of the birthing parent. Baby is very familiar with the sound of the voice of the non-birthing parent. Okay, so babies are familiar with their parents in 2 different ways, which is why you guys are also going to bond with baby differently. Okay, Sometimes birthing parents, they do the snuggles and they do the feeding. Sometimes the non-birthing person is the one that maybe does the showers or does the diaper time. Like, you guys can bond with baby in different ways. Skin to skin is great, but if you're a person that doesn't like all that feely touchy, it's okay to do something different. Okay, just spend the time that you feel in the way that you feel is best for you. The second thing is, babies don't have the capacity to manipulate you. Not yet, okay? Not yet. And I say that because, yes, your newborn is crying for your attention. That is true. But it's not in a malicious way. It's just their way of saying, hey, something feels weird. Are you close by? And if I cry, will you come and just let me know that you're close? Give me that reassurance that my parent hasn't gone too far, that I haven't been left alone. They're learning how to trust this new world of theirs, and you reacting to their cries is a huge way of them knowing that they are okay. So no, you're not spoiling your newborn by holding them and loving on them in those first few months. Enjoy the snuggles as much as you can. So in closing, relationships do change, but they don't have to dwindle because you're focusing on your baby and your recovery. The relationships that you have may just need to kind of morph and adapt and adjust in a couple of different ways. Just be sure to express what you need, express your capacity. So if you're at your limits, and also express your boundaries so people can respect them. Hope you guys like that.
Thank you, Fiona. My favorite giggling part, even though yours wasn't really like giggly worthy, that wasn't the theme, was that your baby hasn't learned how to manipulate you yet.
Yeah, it comes.
It's so true. Thank you. And next up we have Larry Ann. And Larry Ann, she strongly believes in the importance of community, and we truly do need a village to raise children. And if she won $1 million, she would move to the countryside and live off the grid. I'm with you on that one, Larry Ann. So let me introduce Larry Ann, and she'll be chatting about preparing your finances.
Hi, everyone. So finances is one of those things where it's hard to kind of think about in like a regular circumstance if you're not a numbers person, but it's super important to start planning for the way your budget's going to be impacted when your bundle of joy comes, because the truth is they're pricey. They're cute and adorable, but they're pricey. So you want to be proactive about this, and you don't want to have any type of sticker shock when things start adding up, when you see how expensive things can be. So the first thing that you want to do is you want to create a budget. If you are employed and you work at a company, you'll more than likely be going on EI when you take maternity or parental leave, and that's a 55% reduction in your income. So that's a lot of income to lose. So you want to either look into your employer's top-up plan if they offer one, or start putting money aside into a savings account dedicated to just making up the difference in your salary once you're on mat leave. So at least you can maintain the quality of life that you have before baby, once baby comes. And if you're self-employed, then you may want to start thinking about how much money you need to put away once you go on mat leave and how long you can afford to stay on mat leave for. You also want to start planning. So you want to plan for a couple of things. The first one is you want to plan for the baby items that you want to get. We all love to make registries. So I think it's best to put the more expensive items on the registry so your family and friends can get those for you or pitch in. And then you can focus on getting the items that may not be as pricey. And if you are going to be returning to work, you also want to start thinking about childcare. Childcare is something that we don't think about more times when baby is still in the womb, but it's something that's important. Childcare is a very big expense, especially if you have more than one baby or one child. So you want to start thinking about what options are available in your neighborhood, what their prices are, or if there's a family member or friend who can pitch in to help with childcare while you or your partner are at work. So you want to put money aside for that, or you can look into daycare subsidies in your region. I know in Peel region, they have a subsidy program and there's no waiting list. So that's an option for you, at least if you know what the eligibility requirements are. Once the time comes, you can put in an application to use that to your advantage. And the third thing is debt. So debt is a biggie. If you have debt, now is the time to squash it. You want to focus on at least eliminating the balances on your high interest debts, like your credit cards. And once you've paid those off, you can either redirect those funds into an emergency fund or into a baby fund, or wherever you want to put that money. But when you're on mat leave, you don't really want to be worrying about paying down debt when you're on a reduced income. And then we have estate planning. And this is something that a lot of people get triggered by. I know it's hard to start thinking about what happens after baby comes, like in case, you know, there was a death, but it's really important. You want to name a guardian for your child or your children if you pass away. And you also want to outline what assets they're going to inherit, what you want to pass down, and make that very clear. So you want to speak with a lawyer to get this done. Don't leave this to chance, because there are certain laws like probate that may make it harder for your family to access your assets, or someone may be making the decisions for your baby on your behalf, and it may not align with your values or your philosophy. So you want to put this in writing so that it has to be honored. You also want to talk to a financial advisor at this time. Financial advisors are great to help you get your budget in order and make a plan for your money, but they're also really knowledgeable as to ways that you can get free money from the government. One such program is the Canada Education Savings Grant, which is a part of the RESP program. And this is basically a grant that matches 20% of your contributions in your child's college education fund, up to $2,500 per year. So that's a good chunk of change to be putting aside for your children and thinking about their college education in the future. So work with a financial advisor. They'll be able to help you get one set up. They'll be able to help you invest it, and you won't have to worry about that. You can put it on autopilot, and that's one less thing to worry about once your child is 18 and says, I want to go out of province to another university or something. Yeah, but these are the items that I think are essential to think about when you're thinking about your finances. And it's always better to be proactive than to be reactive, and talk to a trusted lawyer, financial advisor, or to other parents in your network to get referrals. And that's all I've got for you guys.
Thank you so much. That was really great. I have learned so much from all of you. And, you know, I know, Larry Ann, you bring up a really great point. We don't want to talk about too much down the road, and if something were to happen, but it is really important. And we do have an amazing lawyer that we've worked with in the past, as well as a financial advisor. If any of you are interested, we can pass on that information. So we've come to the point in our meeting where we would love to have a bit of fun with you. So I have created breakout rooms for each of our guests to meet with a team member, just to see if you have any questions and say hello and get to know you a little bit better. So what's going to happen is you're going to see a little notice that's going to say, go to breakout room or something, and you're just going to click that to say yes. And then when you're done, you can come back to the main room whenever you'd like. So I'm going to go ahead and see if that works. Oh, maybe Anna left. So is there now? Who else is here? Just the three of us? Okay, awesome.